Welcome to our second podcast on lymphoid tissue. In this second podcast, we'll be focusing specifically on the thymus. And by the end of this unit, we will be looking and examining the structural components of the thymus, the cellular components, and really looking at the function of the thymus overall in terms of its contribution to the immune system. So the thymus, when we look at this organ, it's one that we don't readily recognize as we're going through the body, and probably in comparative anatomy, you just totally obliterated it as you were dissecting your cat. But the thymus is extremely important for the development of T lymphocytes, and that's where we get the T terminology there. That stands for thymus. It functions as a primary lymphoid organ because this is where the T lymphocytes are going to mature, and they're largely going to be screened. And when we say screened, we mean that these T cells are going to be screened for a fully functioning receptor. If it doesn't function well, so if the affinity is too low or if it's too high, those cells will be destined for destruction by apoptosis. Or if they recognize self-antigens, those cells will be signaled to die, and then macrophages that are resident in the thymus will remove them. So in this illustration, we can see the thymus situated superior to the heart, sort of in the upper mediastinum, as it's called. And then in comparative anatomy, this is likely what you saw. Here we can see the thymus, and here we have the heart. Here you can see a lung, and you can see some of the fatty tissues. So a lot of this people just remove thinking it's fat because they're trying to get at the vasculature, looking at the aortic arch and looking at the other vessels. But this is the thymus tissue and what it looks like, again, in the central or upper part of the mediastinum. Now, overall, when you look at the thymus, we're going to see this structure, and it's going to be, probably most functional at birth. And then as we get toward puberty, it's going to enlarge progressively, but then it's like a roller coaster. You go up the hill and then you go down the hill. So when we get to around middle age or so, the thymus is going to be back to weighing approximately what it was at birth. And this process is called involution. And we'll look at the difference between a neonatal thymus and then a middle-aged or an adult thymus. And we'll see how it somewhat goes away. Now, while the thymus is somewhat amorphous, as we saw in comparative anatomy, we do in fact have right and left lobes with a very thin capsule surrounding each one of the lobes, and they're connected across the midline by just simple connective tissue. Now, within the thymus, much like we saw with our lymph node, we are going to have the capsule diving down and subdividing a cortical region into different divisions, and then the deeper portion we're going to see is the medulla. Now, in this particular organ, the cortex is going to be much darker because we have a greater density of cells, and the medulla is going to be lighter in color. And we're going to see this scattered throughout these individualized compartments that are broken up by our connective tissue septum. So in our illustration, we've got our capsule here on the right. And we've divided this region of the thymus up into this cortical tissue and our medullary tissue. Notice these illustrations, you've got all of these lymphocytes packed so tightly together. And here we have a lot more spacing, this lighter color with fewer cells in between. That's going to give the medulla its lighter color and the darker color to the cortex. We can also see these yellow cells that are present in here. These are going to be our reticular cells, and we're going to have a number of these that are going to protect the vasculature in areas where cells can gain access or the cells can leave the thymus and enter the circulation. But notice we also have epithelial cells that are forming a boundary between our cortical region and our medullary region. These epithelial reticular cells are going to be important for creating somewhat of an immune isolated compartment. The cells that are within these compartments are not going to be able to leave. And each compartment then is going to be isolated from the next. And we'll see the importance of that as we look at the screening system as our T lymphocytes mature. So here we have a section through the thymus, and you can see the individual compartments that we've created in this organ. And you can also see the darker outer regions and the lighter inner. This is the cortical region that's dark and the medullary region that's light. And you can see these in many of these individual compartments. Now here we have the difference between a neonatal thymus. We can see again our cortex. We can see the lighter medulla. And now in an adult, possibly a middle-aged adult, we have so much connective tissue. We've got fatty tissue deposited in here that really it's difficult almost to pick out the cortical darker tissue and the medullary lighter tissue. It's almost completely involuted and become connective tissue proper. So as I mentioned earlier, the cortex appears darker because of the tremendous number of T lymphocytes that have migrated into this area. Now, these cells are going to be thymocytes. They're immunocompetent, and once they mature, then we're going to call them T lymphocytes. So in the cortex, we have the thymocytes, or T lymphocytes, macrophages, and then our organizing and protective epithelial reticular cells. Now, when we look in this field, the predominance of nuclei that you see are going to be T cells, or these thymocytes. The larger cells, the lighter cells, we're going to be the macrophages, and then we're going to have epithelial reticular cells. And you could recognize them by their stellate shape, but that's going to be difficult at best in a low mag shot that we're seeing here. Here we have a closer mag, and again we can see our T lymphocytes, and those lymphocytes, remember, are mostly nuclear material. And these larger cells that are being pointed out, these are going to be our epithelial reticular cells. You've probably got some macrophages in here as well, probably a macrophage here, but those are difficult at best. Here we probably have some epithelial reticular cells, and I like that even more so than looking at these. So we're not going to distinguish these individual cells in these magnifications of the thymus. Now we mentioned the reticular cells, and now we're going to go through and define these different types of reticular cells. The type 1 cell, we're going to find these in the cortex, and these are going to separate the cortex from the capsule and from the trabeculae. All right, we've got the capsule on the very outside. That capsule is going to be continuous with the trabeculae, and these are all going to be coated with these type 1 reticular cells. Now, these are also going to surround all the blood vessels in the cortex, and they're going to have these very tight junctional complexes that are going to prevent any material from getting in and out of the cortex. So we do have this immuno-isolated compartment within the cortex, and that's facilitated by these type 1 reticular cells. Now, type 2 cells are also going to be here in the cortex, but they are going to function to divide the cortex into smaller compartments. They're going to have desmosomal junctions, so it's not the tight junctional complexes, and we really don't mind that material that's in the cortex can move from one place to the other in the cortex. We're not going to immuno-isolate with these, but these are going to be structural in subdividing the cortex into smaller regions. Now the type 3 cells, these are going to be at the corticomedullary junction. Sometimes these are referred to as juxtamedullary, or close to that boundary. And once again, these are going to form the tight junctions, and they are going to separate, immunologically separate the cortex from the medulla. So nothing is going to be able to simply diffuse and pass from the cortical region into the medullary region. Now, in addition to their structural role, type 2 and 3 of these epithelial reticular cells are also going to be APCs. They're going to present antigens, the major histocompatibility complex 1 and 2 molecules, and they are going to work to present them in the screening process to our developing thymocytes. Now, the T cells that recognize self-antigens, or that have the MHCs 1 and 2 that are not functional, meaning they bind too tightly or they bind too weakly, they are going to be signaled to undergo apoptosis, and they're going to be removed by macrophages. And here in the thymus, sometimes they're referred to as tangible body macrophages, but for all intents and purposes, they are the macrophages that we know, and they will be removing the debris that's left over from apoptotic thymocytes. Now, we're going to have 6 types of epithelial reticular cells. Type 4, these are also going to be so we have 6 types of epithelial reticular cells, and type 4 are also going to be present and help to form the corticomedullary junction. Type 5 cells are going to be structural in nature, and they form what is referred to as the cytoreticulum, or the structural framework of this medullary region. Now, lastly, the type 6 epithelial reticular cells are going to form the very characteristic whorl-shaped structures of the thymus that are called Hassel's corpuscles. And once you see these, then there will be no question in your mind you are looking at the thymus. So here we can see a lot of our thymocytes. You can see the epithelial reticular cells, and then all of a sudden you see this whorl type structure. It almost looks like an onion, all these concentric rings. And this is a very classic Hassel's corpuscle. And once you see these, then you know absolutely you are looking at a section of thymus. Here's another micrograph. Again, not quite as clear, but a lot of small T lymphocytes present in here, these larger reticular cells, and I would wager that some of these are going to be macrophages, possibly over here. But then we have this whorl type structure, and that is a Hassel's corpuscle. Now, once again, even though we have our T cells, although they're immunologically challenged, immunologically isolated, we're going to have a blood supply coming in. So as our arteries come in and veins leave, our capillary bed is going to be present in the corticomedullary junction, and these are going to be of the continuous type. And again, they're going to be covered by our type 1 epithelial reticular cells, and so this is going to form the blood-thymus barrier. But while cells can't cross that barrier, self molecules are going to be able to cross. They're actually going to be transported out of the bloodstream and into the thymus for the process of screening these cells to make sure that the T cells that are going to be released into the circulation don't recognize self. Now, much of the control of T cell development and T cell progression is going to be mediated hormonally, and specifically by the localized reticular cells. So, of course, we have thymopoietin, just like we had leukopoietin and erythropoietin, but we also have these regulatory hormones, thymosin, thymulin, and thymic humoral factor that all are going to contribute together for the proper progression of thymocytes into mature T cells. Now, extrinsically, we have these other factors that are coming in, adrenocorticosteroids. Once those hit the thymic cortex, they are going to decrease that cell number. Thyroxine from our thyroid gland is going to stimulate the reticular cells to increase thymulin production and therefore ramp up T cell development. And then somatotropin is also going to promote enhanced T cell development. Somatotropin, remember, being growth hormone, is particularly going to be active during puberty, and that's one of the reasons why we will see our thymus at its largest and contain the most T cells at puberty, because of all the different hormones coursing through the body during that developmental stage.